much, everybody, for joining us. There's going to be some other people I know who are going to be joining somewhat late, but thank you very much and welcome to the Network of Alberta Health Economists, NOAHE. It's the 7th rounds that we've done, series of events, and this is session number 2 in our current round session. My name's John Sproul. I'm Senior Policy Director with the Institute of Health Economics, and I'll be facilitating this session. And it's a great pleasure to welcome a longtime friend and colleague and our presenter today, Don Husereau. It's always great for him to even virtually come back to Alberta. Don was born, I think, but certainly lived most of his kind of life, a large part of his early life in Alberta. And he's an adjunct professor with the Faculty of Medicine at the University of Ottawa. And Don's worked with a bunch of public agencies, CADIF and others, but also works with private and public sector life sciences organizations to help them navigate and understand the value of health technology and its implications for health and innovation policy. And he's done a lot of contribution to various national reports for national agencies, as well as he's worked extensively with the Institute of Health Economics as a research associate. He's here today because he's currently chair of an international task force that's developed what are called the CHEERS standards, which is the CHEERS statement, the Consolidated Health Economic Evaluation Reporting Standards. And they've been endorsed by leading biomedical and health policy journals. I think it's version number 2 or 3. Don can provide that information. And he's an editorial advisor with a number of biomedical and pharmacoeconomics journal. And I'll pass over to Don to provide his presentation on the CHEERS statement, the process for development of this new updated statement, which involved a bunch of international colleagues, how it's currently being used, and its ongoing application. I would want to say that you're going to be muted throughout the session, but submit any questions using the Q&A function. If you could please use the Q&A function, not the chat function. And we will be looking through your questions. If there's some come up through the presentation, I may interrupt Don and try and prompt that question, but we'll be answering as many questions as we can at the end of the Don's presentation. So thank you again for joining us, and I will now hand over to Don Husereau.
All right, thank you very much. And I did put the new CHEERS statement here because yesterday Kenneth tweeted about it. So even though it came out in January of 2022, but I thought it was kind of interesting that it was tweeted about yesterday. So and now you're getting the new CHEERS statement. So not too new. In fact, it's been cited quite a number of times. I meant to look up the number, but somebody else can get that. Since its release, and we're quite happy about that because that's the whole point of a reporting guideline, is that people use it. As John mentioned, I work out of Ottawa. I have an appointment at the University of Ottawa. I do work for a bunch of life science companies, Institute of Health Economics, but I also do work for not-for-profits, including even currently I have a role with CADIF facilitating one of their advisory groups. And I did formerly work with CADIF, just in case you're wondering, at the early part of the 21st century. I did serve on their expert committee as a health economist on their oncology expert committee. I also served as a health economist in the committee to evaluate drugs in Ontario. I do have, as I said, an adjunct appointment at the University of Ottawa. I'm an editorial advisor for a couple of journals. I've been interested in HTA. If you Google me, you will also see I actually am a professional magician, although I don't do a lot of that. And some of you have been victims of that. So I'm happy to see that you're here attending the Zoom. So what is CHEERS? As John just pointed out, CHEERS stands for the Consolidated Health Economic Evaluation Reporting Standards. The whole thing was an attempt to take existing health economic evaluation reporting guidance and consolidate it and come out with something that everybody could get their heads around. And we came out with that in 2013, where I chaired this task force. It was a ISPOR, what ISPOR calls their Good Practices Task Force, or Good Research Practices Task Force. But at the same time, we did a lot of back work in the background to make sure it was recognized as a primary reporting guideline. So if you go to the Equator Network, and you should do if you're doing any kind of research to look at research reporting guidance, you'll see Cheers listed up there as one of the sort of main guidelines. It has the original Cheers was also used since its original publication by funding agencies like the NIHR and even international organizations like PAHO and UNETA. So it had a lot of good uptake, and we were quite happy about that. But that was in 2013. So about 2020, we said, well, we probably should be updating this. It's like 7 years has gone by, and isn't that Moore's law? Like 7 years, shouldn't we be thinking about an update? So we did think about whether it was outdated. We did note that Cheers was a little bit model focused, and there were people, very serious folks in the community who were basically saying economic evaluation is not all about models. There were reporting guidance that came out from the second panel. There were ISPOR task force reports and other things, and there were some methodologic developments. For a while, we saw optimization, constrained optimization modeling come out. Lots of reports on preference measurement, creating PROs, value, lots of reports about value, what that is, the value of flour. And there was also some study about reporting guidelines and how Cheers is being used. And we had some indication that Cheers was not being used appropriately, even when it was used. And we certainly knew it was being used as a scoring system, which was never designed for to begin with. And we also knew that economic evaluation was taking a bigger and more important place in public policy, including drug decisions, public health, and you name it. So we thought, well, it probably is time to revisit. So motivating that, we sort of started down the road of, well, we did look to see, did the original Cheers have an impact? Actually, at the time we developed Cheers, we didn't know. There was a publication that came out last week by Ferran Catalan Lopez, and he actually looked at the use of, and it's a very interesting article. It's coming out in journal ClinEpi, I think next, like it's published, but I think it's coming out in their next issue or something like that. Looking at the uptake and use of reporting guidelines and health economic evaluations. And it turns out they do actually make a difference. That if you are seeking to replicate a model or replicate an economic evaluation, you are 1.5 more times likely to do that if you are reading an article that has followed a reporting guideline, or at least says it's followed a reporting guideline. And we knew that Cheers was widely used. As I said, a bunch of organizations had taken it up, but we also knew it was cited quite a bit and downloaded quite a bit from the ISPOR website, and it had been translated into multiple languages as well. So the starting point with Cheers was who are we trying to help? Ultimately we can say we're trying to help patients, but really the primary intent here is to help editors, to help people and peer reviewers, people who are actually trying to make sense of research. So that's either researchers who are trying to make sense of research, or editors and peer reviewers who are trying to make sense of it so they can publish it. But at the end of the day, Cheers is about creating minimum reporting standards so that people can actually make sense of research. Now, there might be other people who want to make sense of research, especially economic evaluation, and that includes payers and HTA bodies, students who actually have to learn not only how to make sense of research, but how to conduct economic evaluation, and patients themselves who may want to make economic arguments or are interested in making economic arguments or need to understand economic arguments in and around their care. So, but primarily it was editors and peer reviewers. We understood that there were others that are impacted. So how do we update it? I have a little flow chart on the next. Uh-oh, my internet may have faded there for 1 second. Apologize. So how do we update Cheers? We went We called up the task force. It was like Mission Impossible kind of thing, you know. All right, guys, we have a new. It's like Ocean's 11. But now we wanted it to be like the next version. So we phoned them up. One task force member, David Moore, who's also a personal friend, said, "Quite busy, but I'm going to get somebody who is actually doing a lot of this type of work to." Sub in. So Lisa Cawley, who I've already just cited in terms of looking at the appropriateness of use of guidelines. We repeated the Delphi exercise, and we established some wider tables. I have some slides here that actually show that a little bit better. So we got Lisa because she is actually an expert in journalology and the study of journals and reporting, and she understands this. She's worked with David Moore quite carefully. And so she understands this quite a bit. We got some other folks. We had Nathorn Changpruk. He has a good understanding of economic evaluation, but also links to Asia geographically, and has been doing work, I think, in Thailand. We had Esther de Becker-Grove, who has done a lot of work in preference measurement and unique outcome measures in economic evaluation. Jasmine Pugh from Taiwan, who worked the HTA body in Taiwan. Sophie Staniszewska, who is a patient scholar who understands patient representation and its role in research. And Dan Mullins, who's a co-editor of Value in Health. It's also done a lot of work in patient preferences. So we tried to kind of get a broader amount of expertise around the table. This was the original group, which included myself and Mike Drummond and some others, including editors like Chris Carswell, and folks who and Chris Carswell and Elizabeth Loader from BMJ, and then folks like Andy Briggs and Dan Greenberg and Stavros Petru and Fede Augustovsky, who have a lot of content knowledge and also have geographic reach, who are sort of experts in their own areas. So this is sort of the governance of what it looked like then. We assembled the task force. In addition to the task force, we had two kind of advisory groups. One was called the Public Reference Group. It was led by Sophie and Mike. We brought in a whole bunch of folks who had a very good understanding of patient representation, patient view. They had worked with NICE. They understood to some extent the role of economic evaluation and could go that way. And then we worked with a huge amount of editors and an editor group because, again, ostensibly this was TIERS is intended to benefit journals who are publishing and judging these economic evaluations to make sure that people can make sense of them. And then we took a wide span of journals. We actually, on some level, we based the journal editors that we involved on a bibliometric analysis of who's actually publishing economic evaluation the most. So we felt like we had it all covered. It's all about governance, and it's all about deliberative democracy in the end. And so we thought we had a pretty good system here. What we did was, again, we revisited the membership. We took a review of existing new checklists and new checklist items. We discussed that. We drafted a new list of items. We put it past the public involvement reference group and the editors group. We had their input. And then we had ultimately an online Delphi, which was a broader group of stakeholders, of experts, patients, industry folks, HTA folks, and editors. I looked to see who from Alberta represented Alberta. And I think the honor fell on Mike Paulden. So congratulations, Mike. You spoke for all Albertans on the Cheers modified Delphi. I think on the previous iteration of Cheers, we might have had maybe Deb Marshall and Mike. I can't quite remember. Possibly Chris McCabe. So through this Delphi procedure, we went back to the task force, and we eventually came to some sort of consensus on which items should be in and which ones should be not in, and then wrote it up. So from Cheers 2013 to Cheers 2022, what did we change? Well, we added a whole bunch of items related to patients or health service recipients, the general public and community or stakeholder involvement, and how you engage them and how you need to report that. That was a sort of a significant part. I'll talk a little bit more about that. We broadened the language to make Cheers a little more, less sort of, it had a bit of a drug-centric, model-centric language to it. It was probably not intended, but we made it much more broad so that we could be talking about economic evaluation writ large, including distributional cost effectiveness analysis, benefit cost analysis, and the like. This is not just about cost utility analysis. This is about any analysis that's looking at costs and impact. We looked at this new up and coming idea of a health economic analysis plan, which is particularly important in the world of trial-based economic evaluation. We felt that deserves some attention. We spent much more time on this distributional aspects, particularly because people have begun to look at or publish or conceive the idea of distributional cost effectiveness, addressing equity considerations. And we also kind of removed this distinction between model-based and single study-based, because it was completely artificial. Felt like there's never an economic evaluation that's entirely based on one single study. There's always some maneuvering, and there's nothing that's ever based entirely on one model. So it seemed like a false characterization. We did more strongly recommend or took a stance about the sharing of models. We felt like if you are trying to publish an economic evaluation that is model-based, at the very minimum, you should be held to a level of scrutiny, which means you should be sharing a model with editors and peer reviewers. Otherwise, what's the basis of your claim? And there's some language in there that sort of implies that maybe you should be sharing it with everyone. I mean, if you want your economic evaluation to be held to public scrutiny, maybe you should be holding the entire thing to public scrutiny. And we also created interactive checklists so that people could go in to a Shiny app and just create and fill out the checklist that way. So through working with editors, which is what ostensibly what we wanted to do, because ultimately this is for editors, so we're working with the entire community, we were able to announce the existence of these guidelines through various journals. And so in 2022, we actually published simultaneously. And so if you're having a challenge publishing in one journal and you're complaining about one editor in one journal, I will tell you, co-publishing in this many journals is a feat, but it was done. So we published in all of these journals simultaneously. So we're able to kind of announce that this was there. And we actually created a Spanish translation ahead of time and published it in the Value and Health regional issue. So if you want to find Cheers, there's a kind of poorly, not so well formatted ISPOR Cheers website, but it does have all the information there. I looked at it the other day and I was kind of thinking maybe I should go back and it needs some formatting. It needs some changes of some kind. I actually often go to the Equator website, which you should be familiar with anyway, because Equator is an excellent resource for when you have to report or interpret qualitative study or randomized control trial, etc. There also is an interactive tool, and obviously I'll be sharing these slides with John, and then you can harangue him for the slides afterwards. Is Cheers available in other languages? Yes, it is. I don't have the links here, but in the Equator website has the links. It is available in Spanish, French, which was newly published in the CADATH website, Mandarin, and Turkish. We actually have potentially Portuguese and Arabic translations being developed. So, and if anybody's interested in translating, you can always reach out to me, and we can discuss that process. What we do try to do and encourage people to do when they're working on translation is work with, if they can, work with one of the Cheers task force members who actually has capacity in those languages, and then also use good practices in translation, particularly standards that have been outlined for translating healthcare tools, instruments, like PRO instruments and the like. So double translation, good validation, that kind of thing. Cheers, like other reporting guidelines, also has extensions. So in addition to translations, extensions are specific cases where people feel that you need to report a bit more information than what Cheers is actually asking you to report. So we see that with other reporting guidelines. For example, famously in my world, PRISMA is the reporting guideline for systematic reviews, but PRISMA NMA, which was developed by Brian Hutton, or led by Brian Hutton and others, is intended for network meta-analysis, specifically reporting network meta-analysis in line with a systematic review. Anyway, there are other extensions like RECORD and others that are useful. We have recently had a value of information Cheers extension published. It was published in Value in Health just last month. There'll be a additional commentary and editorial in MDM, I think like this month. So it's quite new. There's some very keen Europeans working on a Cheers climate on climate change implications, and how that should be baked into economic evaluation, how that should be reported. There is a even similarly clever group working on AI machine learning out of the UK. And there's a group, I think Carl Ash, who's a former Alberta health economist, is part of that group, working out of the US on digital health. There are, of course, we've done lots of education. As it turns out, when you write a report, people don't read, and people don't beat a path to your door. They actually, you need to explain to people and talk to people about what's going on. And so we're doing this kind of thing. And so it's my pleasure to do this kind of webinar. I hope this will, encourage you even further to the use of Cheers. We did develop a patient user guide, and this is a timely webinar because just published like a month and a half, 2 months ago, was a commentary in this journal, which is a patient engagement journal, which actually explains the process of, and it's very unique we're one of the only reporting guidance documents that has ever created a patient user guide, involved patients, and the patient user guide, the actual patient user guide, is an appendix to this commentary. And then we do hope to evaluate the impact of Cheers. If any of you are thinking you would like to evaluate the impact of Cheers, please, reach out. Be happy. And there may be other things that we can do in regards to Cheers. And I'm open to suggestions always. So you would go to the Equator website, go to the ISPOR website, contact me. I'm happy to collaborate on any and all, or at least listen to proposals. And myself or somebody else with the task force would be happy, I'm sure, to collaborate on really good proposals. And there's no formal process. It's just, you basically have to phone me up. I'll give you the phone number is actually on the Cheers article. So you can just, and I think it's at the end of my slides here. So you might be wondering, well, what issues rose during the update? Was it smooth sailing? There were issues. We did have to think about what types of analyses, and I think I'll get into that in the next slide. does Cheers deal with budget impact analyses, for example, or is that too far afield? We had to deal with certain items that might have scored low in the Delphi panel exercise, and what to do about those when we felt that they were important. And I'll talk about that. We had to think about transparency and how far to push it. And I've already touched on that. We also have some errata that I will touch on, which are not large. And I'll get into some of the limitations of Cheers. And the elusive Cheers beer coaster. Well, there's no elusive beer coaster scandal, but there is a Cheers beer coaster, which was produced illegally, and some special individuals have access to the beer coaster, but that's a whole other story. Okay, so some of the issues: inclusion or exclusion of some types of analyses. Budget impact analyses, we excluded them because, of course, they do not ever fully consider the costs and consequences of alternative courses of action. We felt like there are budget impact analysis reporting guidance. There, of course, in Canada, we have reporting guidance that were developed years ago by the PMPRB, but we have also through ISPOR good research practice task force, there have been reporting guidance developed as well. We thought about optimization modeling studies. Actually, I was thinking about optimization this morning because I've been involved in assessing an economic evaluation where, it became clear how the limitations of using standard approaches to economic evaluation when you have a comparator that is very, very, very rarely ever used, but it happens to like drive the efficiency frontier. It's kind of disingenuous to even think that it should be on the efficiency frontier. And of course, optimization studies can deal with that, but there are also reporting guidance around optimization models. And again, that's a whole different type of study where the economic evaluations are the inputs, not the outputs. We had to think about freestanding preference measurement studies and what to think about those. And again, so this is sort of the flip side of the budget impact. It's all about consequences and not about costs, I suppose, or it's all about preferences for things. And again, there are other reporting guidance, so we didn't go there. But you might be more interested to hear what Mike Paulden and others scored as potentially low, although I can't speak to him because this is average scores. Characterizing heterogeneity was actually scored. We got fairly low marks on the need to characterize heterogeneity. And what we felt like was this whole concept seems to be maybe more of a UK Canada concept and maybe not so much in other jurisdictions. And some people do have objections to ex post definitions of subgroups. So, the UK uses subgroups quite a bit. And Canada's sort of middle of the road. And so we felt like it might have been something we were seeing from, I don't know, a kind of bias of people that we were asking. We did ask people about distributional effects, which we thought was important because there's more and more people thinking about equality. CADETH, for example, is announcing their push into the world of equality, equity, sorry. I should say equity, not equality. However, we got sort of low marks, but we felt like we shouldn't ignore it. People are, it's logical that people are more and more going to be concerned about distributional effects. And there are some real merits to considering not how many qualities people get on average, but who gets the qualities. So it's something we felt like shouldn't be ignored. So we put it in. And then I guess maybe not surprisingly, we got sort of low marks on patient and public involvement and engagement. Because if you ask a bunch of researchers who never engage with patients, what do they think about engaging with patients? They give it a low mark and say, what does that have to do with economic evaluation? However, we're doing all of this research ultimately to benefit patients. So we felt like it was a little untoward not to think about their involvement, at least say, how did you involve patients and how did you involve them? The other thing that's really interesting about economic evaluation is, more often than not, particularly with life science companies, they engage with clinicians to help parameterize their models and things, but that stuff is never reported. How many, we engaged with, clinical leaders. Well, how many? Who? What do they say? So we wanted to make sure that that whole aspect was getting attention. Plus, in this new world of doing economic evaluation in lower middle income countries, looking at large scale projects, for example, we do have to, and there has to be some level of community engagement that occurs, and there's a whole new and emerging kind of fields of research looking at how do you report that, how do you do it, and how do you report it. And so we thought it couldn't be ignored. It's the future. And then there's transparency. So that manifested in a couple of ways. One is the health economic analysis plans. Of course, not everybody's doing them, but we felt like, why wouldn't you, if they existed, why wouldn't you want to know the existence of those plans? Because you would certainly want to know if somebody deviated from them, just like you would with any statistical analysis plan. And similarly with the models. I mean, why would we sort of play the part of an agent that says it's okay to keep your models if you want to say things publicly about the cost and consequences of things, but you don't want to tell people how you did your calculations, or at least have them be able to replicate them. Research is about replicability. You don't have to share a model. You can share enough information so that a person can replicate a model. But of course, in this day and age of very sophisticated models, that might not be an easy thing to do. There was just an economic model published, I think yesterday or the day before, from BC around pharmacogenomic testing and mental health. It was a huge discrete event simulation model, which they plan to make public and publicly available, as far as I can tell, which is a good idea, but not something you can easily replicate just with descriptions. So we sort of talked about this and ultimately came up with some recommendations about how to deal with this. Basically, if you are asked, you should be sharing models, and you should be encouraged to share, and if you're not sharing your model, you should be at least describing things enough so that things are replicable. Otherwise, what are you doing? You could say anything. There were some errata. I'm not going to get into it. However, we made some, I guess, references that were wrong. There could be incorrect citations, which I'm sure that wasn't my fault. And some limitations of Cheers. First and foremost, if you look at Cheers, you might say, well, I don't agree with some of this. Well, remember that we did ultimately, Cheers is the result of a bunch of deliberation. So we consulted with folks. In Alberta, we only consulted with Mike Paulman, so it's possible he doesn't represent everybody's views. On the other hand, we did consult with many other individuals as well. But at the end of the day, we didn't consult with every single health economist on the planet, so who knows? It's possible that we could have, more could have been said for specific applications of Cheers. For example, interventions that have impacts beyond health. I'm talking a lot about genetic testing these days, and that has spillover effects, for example, in terms of education. But we have other technologies like mental health technologies that have spillover effects in justice, that kind of thing. Cheers still addresses those types of economic evaluations, but we didn't really elaborate. Certainly, I guess that's why extensions are something that we would encourage. So, we would encourage people who want to expand these items to reach out and say, we're interested in a certain type of economic evaluation. We think that Cheers could be more specific, and then they could develop extensions in these areas. So in summary, I hope the health economic outcomes research community, health economic outcome research community, there's a double research there, community, as well as journal editors and peer reviewers will find Cheers 2022 useful and continue to use and endorse it. it has been adopted. It continues to be, I mean, now even Canada's tweeting about it. So like, I feel like we made it potentially. I should check to see, I said I would check to see how often it's been cited, but I'll check here. So far, Cheers 2022. Well, it's hard to tell. I think it's had a fair amount of citations. 574. Not bad. We're getting there. So that means that some people are using it. We hope that they're using it appropriately, and that's why we wanted to. That's why we created such elaborate guidance to help people use it appropriately, and I hope you do as well. And again, we welcome proposals to work with Cheers, either to develop extensions or translations. Yes, please reach out. I don't know if I have a. Oh, there we go. That's my phone number, and that's my email. I'll pause there. Maybe there's. John, are there questions?
Yeah, there are,
yes,
there's
there are
a few questions, but thank you very much, John. I know you put a significant amount of work into this, and I think it's a useful, accepted platform that we can now attach to, because I do know with standards, they're often littered everywhere in all sorts of obscure places. And so I think for people navigating some kind of more consolidated place and guidance for people in the field. But we've got some questions.
Yeah, I can take them on.
Yeah, do you? I'll just go through. A question did come up about the presentation being available. Yes, the video of the kind of this presentation, as well as a PDF of the PowerPoint, will be posted and on the NOAA website, so that will be available to individuals to use. But the first question is, I don't know if you can see them, Don. Cheers.
Yeah, I can see the questions.
Okay, so if you can go through and answer those.
So one is Cheers is only used to evaluate the report, but it doesn't necessarily mean that we should include in the methods all the analysis mentioned in Cheers. So in other words, we should report why we did include those analyses as well in order to follow Cheers. That's right. I mean, so Cheers is just asking you to report what you did. So you have to think, because you want other people to be able to replicate. It's not making any judgments in terms of your methods. So if you did something in a way that's dubious, that's up to you. We're asking you to report it. If you, let's say, are saying we use a randomized controlled trial to inform our effectiveness estimates, we're not asking you necessarily to report the entire randomized controlled trial. Although what we are asking, we're saying, hopefully that randomized controlled trial was reported according to the consort guidance. If not, maybe you want to include an appendix or something that spells it, that helps people interpret that randomized controlled trial. Similarly for preference measurements and the like. And sometimes with economic evaluation, you're including new things that are never been published before. And in that case, again, in order to allow us to judge what you've done, we would encourage you to report your methods. But you know, we recognizing word limitations, which are arbitrary and were invented in 1893. We don't really have word limitations now with digital publication, but we still do. But you can have appendices. That's the point. So I hope I'm getting to it. I mean, if you're referring to another analysis, you're probably okay as long as you're citing it, and then you should do your due diligence, make sure that other analysis is well reported. I would hope. Of course, if you're citing analyses that weren't well reported, how do you know how reliable they are? I hope that helps. Let me know. Okay, and then Camilla, you said, does the item 13 on the evaluation of outcomes apply only to CBA and CUA? That's a good question. We are not saying, so that the item 13 is just describe the population and methods used to measure and value outcomes. Oh boy. And then, so yes, we are. Well, no, I mean, so you can do a, yes, that's right. So when you're doing a cost benefit analysis or cost utility analysis, you are valuing outcomes by virtue of looking at preferences and then applying some kind of value. But you're right, like if you're doing a straight up cost effectiveness analysis or cost minimization, analysis, you're not applicable. And so what you would put in that checklist is just not applicable. I hope that answers your question. Not all items apply to every economic evaluation. There may be situations where you just say, this doesn't apply to me. And that's fine. Camilla also asked, does the health economic analysis plan, which again may not apply to you, and you could say not applicable, we didn't have one. Can it be available on request? Yes, you could say we have a health economics analysis plan, it's available on request. You could say it's in an appendix. You could say we didn't have one, we didn't do one. That's all good. So I hope that helps. Sarah, this is like rapid fire. I hope this is helping. Sarah says, in a systematic review of cost-effectiveness studies, is it okay to appraise the included studies by Cheers? Well, yes, it is. As Cheers' reporting checklist is not a critical appraisal checklist. If using for critical appraisal, well, Cheers is you can appraise a study in terms of the quality of reporting with Cheers. We would assume that you could look at the Cheers items and say, this was well reported because all the things that Cheers is asking for are in there or not. Of course, the quality of reporting doesn't tell you anything about the quality of methods. So somebody could do something really dumb, like, they could do an economic evaluation of a chronic disease and where impact of things for 30 years in the future, but they don't even use a discount rate. But if they say we used a 0% discount rate, well, perfect. You've actually reported the discount rate. So from a Cheers standpoint, the quality of reporting is excellent. From a method standpoint, an economist might say, well, gee, I mean, we would value those outcomes a lot less, given that they're decades away. So you can appraise the reporting, but you can't necessarily appraise the methods. There are other checklists for appraising methods. I like the checklist. That's the one I sometimes use. There is a new checklist that's spelled with a Q. David Kim's checklist from Tufts, but it's a little more complicated, but it just came out about a year ago. And it actually tries to address methods and reporting, but it conflates them a little bit. So buyer beware. I would just go with a methods one and a reporting one. Keep it clean. All right. Camilla, back to Camilla. How are we doing, John? Is this okay that I'm just doing a rapid?
No, I think yeah, it works very well. There's and there's one from Mike, which you'll enjoy. So that's
we got one from Mike.
Yeah.
I don't see it yet. Oh, maybe it's in the chat. No? Oh, I don't see it. Okay. Back to Camilla. Why is it important to publish or share the health economic analysis plan if it may change? Well, actually, listen, this is where being a magician helps. It's always helpful to understand if the plan changes. By the time you get to the end, it tells you a little bit, but it's okay if it changes. Sometimes there are legitimate reasons for things to change. So you could share the original health economic analysis plan. You could share the one that changed after engagement. I don't know, as long as you report what you did. I mean, at the end of the day, what I want to know, why do I want to know you have a health analysis plan? I do want to understand whether you went on a fishing expedition. And, the plan can help me understand that a little bit. So I can understand whether there's some sort of, survivorship bias with your outcomes.
Yeah. Don, I might ask Mike, because Mike did put his in the chat, but since he said good presentation, Don, but since he confirmed that he speaks on behalf of all Albertans, so he's confident.
Oh, he's confirmed that. That's good. Yeah.
He said, but
that's not a bad person to go
totally,
with.
But that's not a bad. It's a very good rep for us.
It's a knowledgeable fellow.
On to Mike's question, which I'll read to you. Which is an interesting one. Some of the items in Cheers are arguably more important than others. Was consideration given to the possibility of weighting the items to allow for an overall score for the reporting quality? Is that even feasible within the Delphi framework that you use?
That's a very good question, Mike. And I feel like I'm on a thesis and you just fed me like an easy question to answer. There was some no, there was never consideration. And the reason there was no consideration is developing a scoring system for a checklist is a monumental task. So it took us 2 years just to develop this checklist. some of the items actually have no, if you think about it really in theory, some of the items don't even help you interpret a study. So the title says the title should say it has an economic valuation. Doesn't matter if the title, it wouldn't matter if the title was like John Sproul's sweater. Like it wouldn't, right? That doesn't help you interpret the economic valuation. The title is helpful for people to find your economic valuation, not to interpret. So it's a bit sneaky. And therefore, like in terms of what's the weight of that in terms of interpreting, it's zero. Like it doesn't really help you at all. And then some things like, did you report, I don't know, the discount rate? That's a little more important. So no, we didn't go there. We also didn't go there because years ago, Peter Juni wrote a wonderful paper highlighting the perils of, you know, of scoring systems and the need for psychometric validation. They have to be valid, reliable, there has to be inter-rater reliability, all these things that these measurement properties. And so evaluating these measurement properties is a monumental task. And so, no, we didn't go there, but you know, others have tried, and others continue to do that. So
Yeah.
Good question, but no, we didn't even consider it. Too much work.
Yeah, and I'll just grab one more question, which was put in the chat too from Sarah, who's asked some other questions, but I think it's a really good one. Should cheers be modified if we're conducting a study in a lower middle income country? Was the country of origin ever a kind of consideration, or how would you address that question?
Oh, now I'm looking at the chat. So thanks. Yes, well, no, LMIC, we took it very seriously. We involved people who were involved with LMIC and LMIC guidance, like Andy Briggs and Federico Ostrovsky and others. So we went into this with an LMIC lens to make sure, and in the Delphi, we did the same. Cheers should never be modified, just like you should probably never modify any checklist, particularly if you're flying a plane. Don't modify a checklist. But you could also, you could say certain things don't apply, or you could, there may be things in cheers that are missing in an LMIC context. We don't think so, but you may want to add in, and you can always report more. The cheers represents the minimum amount that you should report. It doesn't tell you what you should report. I hope that's helpful. Now I'm looking at the chat and the Q&A, and I haven't gotten some things. Where are we? I should have typed answer live for some of these.
Yeah, one actually, I think you can. The only other one in the chat, and there are some repeats of the same question that was around low-income countries, which I think you answered. But one is in a systematic review, and that's part of your kind of past experience and territory of cost effectiveness studies. Is it okay to appraise the included studies by cheers, as cheers is a reporting checklist and not a critical appraisal checklist?
No, but I think I addressed that one. You're appraising the reporting quality, but you're not appraising the quality of the methods.
Yeah, okay.
Camilla also asks, why is it important to publish or share the health economic analysis plan? If it may change, okay, yes, we answered that. What else did we get to? Weighting of items. I think we're getting pretty good here. I did not check them off. You see, I didn't follow my checklist. I should have been checking. There we go, and then there, and that's item 13 we talked about. Health economics analysis plan, share. Do you think the checklist is suitable for low-income countries? We've got that too. I think we've covered a lot of this. But again, I would say if you're doing LMIC work and you think that there's things missing, again, it might call for an extension of cheers.
Don, you presented the kind of conflicts and various kind of things. What were the biggest kind of disagreements you found across the community of people? And praises to you and the group for actually really bringing a pretty robust group of people together to work hard on this moving forward. And I do think academic communities have to collectively do this kind of peer work for their field. But where were the areas that were the most split? Because some were clearly kind of slam dunk, but what was the one that surprised you the most where there was conflict?
I think it was a split, but I mean, as I said, the patient and public involvement and engagement had a very low mark. And I imagine that has to do with traditional ways of doing, as I said, economic evaluation. We're the only people you're really engaging maybe are some healthcare service providers, but not really anybody else. And you may not even engage those people. Forget about patients. Like, what does that have to do with anything? So I think people just didn't respond to it, but we felt like it's the future. I mean, engagement is the future, first of all, and then patient engagement is a very important component of that. And so you can't get around it. And so we kept it in. I mean, despite being asked by the Delphi, like, or being told by the Delphi, oh, it's not that important. Does it help you interpret a study to understand how and when patients and communities and others were engaged? Maybe it doesn't help you that much, and maybe it helps a little bit, but I think in a way what we're trying to do is also encourage the community to think about engagement. If you put in a reporting item like talk about whether you had a health economic analysis plan, it might encourage you to think about developing one. And that's one of the beautiful things about Consort and Cheers and other reporting guidance is for a new student or somebody who's new and trying to understand what the end product is, which I would encourage anybody who's new at this to always think about what you're going to be at the end. You need to think about these things. So yeah, we were really trying to encourage folks.
Is there because Cheers, I know you're trying to do linkages and being an information source. I'm just wondering because often there might be a number of standards and guidance that you might want to use in conducting some health services and policy research that might involve economic evaluation. Is this all scattered in different types of qualitative research methods, health economics methods? Is there a useful place where you go that has useful navigation and links to the variety of types of guidance for articles that you might suggest?
Well, for reporting guidance, as I said, I go to the Equator Network website, and I would highly recommend you go. And of course, once you read reporting guidance, I've had to assess a number of reports that were qualitative research, and I'm not a qualitative researcher. But you go to the Equator Network website and they show you some of the more established and endorsed qualitative research reporting guidance. Once you get your head around these reporting guidances, they then point you to methodologic guidance. And so I do think it's a good way in. I mean, if somebody's asking you to report a discount rate, you might start asking, why do I need to report a discount rate? And that will lead you to Mike Paulden eventually. Once you start asking that question. So yeah, I mean, in terms of what does it mean? What does a discount rate mean? What's an appropriate one?
Okay. No, thanks very much. And I think we don't have any more questions. So all that's kind of left is to thank Don for giving a very informative presentation, a thorough review with lots of information. And we will be posting the presentation, as I said, the actual for people to share and use at their leisure. And make sure to register everybody for the next seminar, which is actually ironically being presented by Dr. Mike Paulden. And actually it's scheduled for January 17th in the new year, 2024, from 12 to 1, and visit the NOAHE.ca for registration and event details.
Do we know what he's talking about?
Yeah, pardon me?
Do we know what he's talking about?
I'm not sure what the topic is, actually. I was going to go look. He still needs to confirm that.
Okay.
Well, I think he's going to have to actually, we'll be talking about the difficult job he has representing Alberta. But,
well, there you go.
But he apologizes to Nicole, who helps run these things, because I think she's waiting for his topic. But good question, Don. And thank you very much, everybody, for participating. Have a great rest of the afternoon. And thank you, Don, very much on behalf of all of us for a very informative presentation. Thanks very much.
Thanks for having me. It's a pleasure.